Setting T low based on the expiratory flow waveform. Now, this is a screenshot of just the waveforms of a ventilator screen, and we're going to look at the flow waveform here in purple, just to get some definitions. So one is the peak expiratory flow rate, and this arrow points to the peak expiratory flow rate. And the other thing here is the peak expiratory flow rate, the termination point. And this shows you where the flow is terminating here before it goes back, it rises again. So when we set T low based on the expiratory flow waveform, we want to titrate our T low to obtain a peak expiratory flow termination point at 50 to 75% of the measured peak expiratory flow rate. So the difference between these two, we want it at 50 to 75%. How do we calculate that? So here's an example of a flow waveform. It's really highlighted in big. And what we will look at is, this is just an example of how we calculate the percent of the peak expiratory flow rate. So here's our peak expiratory flow rate, and it's approximately 1,050 milliliters per second. And the peak flow termination rate is right here, as this yellow arrow points out, is 350. So what we do is we take the 350 and we divide that by the 1050, and that's not really shown up, but 1050. And that equals approximately 33%. Right there. Between 50 and 70%. So here are some examples. This is a 50%. The next one shows 60%. And then the next one shows 75%. So what we're doing is we're setting our T low based on criteria, based on the initial settings, or based on the respiratory time constant. And then we titrate it. We adjust it up or down to get it in these ranges. And this is a very popular way of setting T low. So T low is a very important setting when using airway pressure release ventilation. So there's an example of 75%. And how do we precisely measure these things? Well, the easiest way is for freeze buttons on ventilator screens. So here's a Vita XL ventilator, and here's an example. What's highlighted is the freeze icon, which allows you to freeze the screen. So this will hold the screen, and this is just a bigger version of the freeze button. And you notice it's like a stop sign. And that allows you to freeze the screen. So what you do is you freeze the screen, it allows you to move the control knob and scroll over to get the measurements. And you notice I scroll over, here's an example of me on a patient. I scrolled it over to evaluate the peak expiratory flow rate, and the measured peak expiratory flow rate is 92, sorry. And then I scroll over to the termination point where it looks like it's terminating. And as you notice, I scrolled over and it's 47. So we're approximately in the 50% range there. And this is just another example. This is a Hamilton G5 ventilator. And how you freeze the screen here is this icon here. It looks like a snowflake. So you just touch that, allows a screen, freezing the screen. This way you can go over, use your control knob, and scroll over to assess your peak expiratory flow rate and the expiratory flow termination point. And you see these little arrows down here, these white arrows. It's a blurry picture, it's gonna be hard to see. Once you scroll over, so that's how you determine appropriate T-low settings based on the expiratory flow waveform. I'm going to use the Ventilator Simulator to reinforce using the expiratory flow waveform to set my T-low setting. We're going to look at the Ventilator Simulator. Here's the screen, and we look at the flow waveform, and my flow waveform is down here. It's purple or magenta. And I'm going to pay particular attention to my expiratory flow waveform. Now, if we look at it, if we trace it out, you notice that it's pretty much returning to my baseline of 0. So my lungs are pretty much completely emptying. Now, what this may cause, this might interfere with lung recruitment and create atelectasis. So we might have oxygenation issues. So what we want to do, as explained earlier, is titrate my T low or set my T low so I maintain some of this expiratory lung volume. So what I'll do is I'll go to my controls and I'll look at my T low and I'm going to change that. So if I increase it, that allows for more emptying. If I decrease the time, I make this period shorter, that allows for a larger, keeping that expiratory volume in there. So I'm just going to decrease this by around 0.5 seconds at a time. Let's go. I didn't do it quick enough, so I'm going to just make some setting changes. And I'm just going to do it by 1. I'm going to take it down to, let's say, 0.6. And let's reevaluate. So we're going to close this out, and let's look at my expiratory flow waveform to see if there's any changes. And as you notice, there are some slight changes. We're starting to keep some of this expiratory lung volume. So I'm going to titrate it a little more. Just take it down to, let's say, 0.4. So all I'm doing is I'm titrating it and I go back to reevaluate it. And now as you look, I can freeze the screen, use the control knob, scroll over, and see actually the difference between my expiratory flow and my flow termination point and calculate if I'm at 50 to 75%, or I can kind of eyeball it. I'm almost at 50, so I might adjust a little more. And I'm just going to decrease this a little more. Sorry. And reevaluate my expiratory flow waveform. And as you can see, we're increasing that expiratory lung volume. We're approximately at 50%. So I'll keep it here and continually reevaluate the patient and evaluate my expiratory flow waveform. So this is setting T low based on my expiratory flow waveform.